What if 1 tablespoon of olive oil, taken at the right time before bed, could quietly support your heart, your brain, your joints, your digestion, and your blood sugar all at once while you sleep? Most people use olive oil for cooking. They drizzle it on salads. They consider it a healthy fat, and then they move on. Almost nobody understands what actually happens inside an aging body when this specific oil, taken in this specific way, at this specific time, meets your overnight biology. After 20 years operating on aging hearts, I have come to believe that extra virgin olive oil at bedtime is one of the most powerful, free, almost completely overlooked interventions in senior cardiovascular medicine. And the reason it works so well at night has nothing to do with folklore. It has to do with what your body does between midnight and 6 a.m. that you have no conscious awareness of. Let me tell you about a patient I'll call Eugene, 73 years old, retired master electrician from outside Hartford, Connecticut. Eugene came to me with 3 problems he had been quietly stacking for years. Stiff joints in the morning that took an hour to loosen, a chronically restless sleep that left him exhausted by 10 a.m., and a fasting glucose creeping into the pre-diabetic range, 126, despite a careful diet. His cardiologist had already adjusted his statin twice and was talking about adding a blood pressure medication. I asked Eugene one question: "Do you take olive oil at any point during the day?" He looked at me like I had asked him about astrology. I told him I wanted him to try one specific thing for 30 days. 1 tablespoon of cold-pressed, high polyphenol, extra virgin olive oil, taken slowly, on a near-empty stomach, 90 minutes before he laid down to sleep. 5 weeks later, Eugene came back. His morning joint stiffness was nearly gone. He was sleeping through the night for the first time in 5 years. His fasting glucose had dropped to 107. His statin dose had not changed. His doctor canceled the planned blood pressure prescription. Eugene asked me, "Doctor, why did nobody tell me about this 30 years ago? I'm Dr. Marcus Okoro. I'm a heart surgeon." Today, I'm going to walk you through exactly what happens inside an aging body when you drink extra virgin olive oil before bed. I will cover the 4 bioactive compounds that make this work, the 5 systems in your body that benefit, the exact protocol I give to my own cardiac patients, the 3 biggest mistakes most people make with olive oil, and how to recognize a genuine high polyphenol bottle from the cheap fakes that flood the grocery store shelves. Stay with me to the end, because the protocol I share at the end is the one I personally use, and it goes against what almost every olive oil article on the internet recommends. Before we begin, drop one word in the comments below. Do you currently use olive oil daily? Yes or no? Type yes if you cook with it almost every day. Type no if it sits in the back of your pantry unused. I read every single comment. This one answer tells me where you are starting and what the first step needs to be. Let me explain why the timing matters first, because this is the piece almost no other video covers properly. Your body undergoes a complete biochemical shift between roughly 10 p.m. and 6 a.m. This is when growth hormone surges, when tissue repair peaks, when the brain runs its glymphatic clearance cycle, the overnight cleaning system that flushes inflammatory waste, including the amyloid proteins linked to Alzheimer's disease. When the cardiovascular system enters its repair phase, with blood pressure naturally dipping 10 to 15%, and the inner lining of your arteries, called the endothelium, actively healing the damage accumulated during the day. When the liver runs detoxification pathways at peak efficiency, and when your gut microbiome shifts its composition in ways that directly affect inflammation, mood, and metabolism the following morning. The body you wake up with tomorrow is built between midnight and 6 a.m. tonight, and what you give it before bed, or do not give it, directly affects every one of those repair processes. This is why an olive oil drizzled on your lunch salad at noon is metabolically a completely different event than an olive oil tablespoon taken at 9:30 in the evening. Same oil, same compounds, radically different downstream effect. Now let me walk you through what is actually inside high-quality extra virgin olive oil that makes this so powerful. There are 4 compounds you need to know by name. The first is oleocanthal. This is one of the most fascinating molecules in nutritional medicine. Oleocanthal acts on the same enzyme pathway in your body, called COX, that low-dose aspirin and ibuprofen target. Both NSAIDs reduce inflammation by blocking this enzyme. Oleocanthal does the same thing, gently, naturally, without gastric bleeding risk, without kidney stress, without the cardiovascular side effects that have made NSAIDs one of the most dangerous over-the-counter drug categories for seniors. Research published in the journal Nature has shown that just 50 milliliters of high-quality extra virgin olive oil daily, about 3.5 tablespoons diaries, produces measurable anti-inflammatory effects equivalent to a low dose of ibuprofen without any of the side effects. For seniors who have been told to stop taking ibuprofen for arthritis but still need anti-inflammatory support, Oleocanthal is one of the cleanest answers available. The second is Hydroxytyrosol. This is one of the most potent natural antioxidants ever measured. Hydroxytyrosol crosses the blood-brain barrier, meaning it directly enters your brain tissue and reduces oxidative damage to the neurons that age fastest after 60. A landmark study published in the European Food Safety Authority Bulletin found that hydroxytyrosol at the dose found in 2 tablespoons of high polyphenol olive oil per day produced measurable reductions in oxidative damage markers in adults over 50. The third is Oleuropein. This compound has been shown in clinical research to directly support endothelial function, the health of the inner lining of your blood vessels. The endothelium controls how easily your arteries dilate and how efficiently your blood pressure regulates. As we age, the endothelium becomes stiffer and less responsive. Oleuropein has been shown in multiple human trials to partially reverse this stiffening process. As a heart surgeon, this is the compound I find most exciting because endothelial dysfunction is one of the earliest mechanical events that precedes coronary artery disease, and we have very few interventions that target it directly. The fourth is the monounsaturated fat itself, specifically oleic acid, which makes up about 70% of olive oil. Oleic acid raises HDL cholesterol, the protective kind, while lowering LDL cholesterol particle number, particularly the small, dense LDL particles that are most strongly linked to plaque formation. This dual cholesterol effect is one of the most consistent findings in olive oil research over the past 2 decades. Now let me walk you through the 5 systems in your body that benefit when these compounds enter your bloodstream slowly, on an empty stomach before sleep, when there is no competing food matrix to dilute or block absorption. System number 1, your heart. The PREDIMED trial, one of the largest cardiovascular nutrition studies ever conducted, followed adults aged 55 to 80 for nearly 5 years. Participants who consumed extra virgin olive oil daily, averaging 4 tablespoons per day in the high-intake group, had a 30% reduction in major cardiovascular events compared to those on a standard low-fat diet. 30%. Without medication, without statins, just olive oil added daily. As a heart surgeon, that number stops me in my tracks every time I read it because it rivals the effects of some prescription cardiovascular drugs. System number 2. Your brain. The hydroxytyrosol and oleocanthal that cross the blood-brain barrier appear to reduce one of the precursor processes to Alzheimer's disease, the accumulation of beta-amyloid plaques. A 2024 study at Temple University demonstrated that oleocanthal selectively destroyed early cancer cells in laboratory tests, and separately, that it stimulated the brain's clearance of beta-amyloid proteins. Long-term olive oil consumption has been associated in multiple population studies with a meaningfully lower risk of cognitive decline. System number 3, your inflammatory load. Beyond the COX pathway I described earlier, regular olive oil consumption lowers systemic inflammatory markers, including C-reactive protein, interleukin-6, and tumor necrosis factor alpha. For seniors with arthritis, chronic joint pain, fatty liver disease, or any condition driven by background inflammation, this is one of the most accessible interventions available. System number 4, your blood sugar and metabolism. Olive oil dramatically slows the absorption of glucose from any meal it is consumed with. Even more importantly, taking olive oil on a near-empty stomach before bed has been shown to improve next morning insulin sensitivity. This is part of why Eugene's fasting glucose dropped from 126 to 107. The dawn phenomenon, the natural early morning blood sugar surge, is partially blunted by pre-sleep olive oil intake. System number 5, your gut and digestion. Olive oil acts as a gentle natural lubricant for the entire digestive tract. It supports the gallbladder by stimulating gentle bile flow, which is important for processing the fats you have eaten during the day. And it appears to support the diversity of beneficial gut bacteria. Many of my older patients with chronic constipation, sluggish digestion, or bloating report meaningful improvement within 2 weeks of starting a bedtime olive oil routine. Before we get to the protocol and the mistakes, let me ask you something. Have you ever bought a bottle of olive oil labeled extra virgin, but had it taste flat, oily, or completely tasteless? Type yes or no in the comments. Your answer tells me whether you have ever actually tasted real extra virgin olive oil, because if you have not, the protocol I'm about to share will not work no matter how diligently you follow it. Now let me cover what actually happens in your body overnight when olive oil is in your system before sleep. Between 10 p.m. and 2 a.m., your liver and gallbladder enter their peak detoxification phase. Olive oil's gentle fat content stimulates the gallbladder to contract softly and release stored bile, clearing accumulated waste from the previous day's meals. This is the same mechanism Mediterranean cultures have used informally for centuries, and modern bile flow research has now confirmed it. Between 2 a.m. and 4 a.m., your brain enters its deepest glymphatic clearance phase. Hydroxytyrosol and oleocanthal in circulation reduce the inflammatory load that would otherwise compete with this clearance, allowing the brain to flush waste more efficiently. Between 4 a.m. and 6 a.m., the early morning cortisol surge begins, the same surge linked to the deadliest window for heart attacks. Olive oil's anti-inflammatory effect from oleocanthal partially blunts the inflammatory cascade that often accompanies this surge in older adults. And from 6 a.m. onward, when you wake, your insulin sensitivity is improved by the overnight metabolic priming, which is exactly the mechanism that explains why morning fasting glucose readings improve in seniors who adopt this routine. Now let me give you the protocol I personally use and recommend to my patients. This is the part most articles get wrong. Step 1. Buy a genuine high polyphenol extra virgin olive oil. This is non-negotiable. Cheap olive oil, the kind on the bottom shelf for $6, has often been diluted with seed oils, exposed to heat that destroys the polyphenols, or stored in clear bottles that allow light to degrade the active compounds. Real high polyphenol olive oil costs between $20 and $40 per liter. It comes in a dark green or amber glass bottle. It has a harvest date printed on it, not just a Best By date, and the harvest should be within the last 12 months. When you open it and pour a small amount on a spoon and taste it raw, you should feel a distinct peppery burn at the back of your throat that triggers a single involuntary cough. That peppery burn is the oleocanthal. If your olive oil does not produce that peppery cough, the active compounds are degraded or never present and the protocol will not work. Step 2. Take exactly 1 tablespoon, 15 milliliters, between 90 minutes and 2 hours before bed, not 5 minutes before bed, not with dinner. The window matters because you need the oil to begin entering circulation before the deep sleep stages start. Step 3. Take it slowly. Pour the tablespoon. Roll it around your mouth for a few seconds before swallowing. This initial oral exposure begins activating the bitter taste receptors that trigger your gallbladder's bile release. Then swallow slowly over 5 to 10 seconds. Do not chase it with water immediately. Wait at least 5 minutes. Step 4. Do not eat anything else after taking the olive oil. The protocol works because the oil enters your overnight metabolic state without competing food matrix. Step 5. Be consistent for at least 3 weeks before judging the effect. The cardiovascular and inflammatory benefits compound gradually. Most patients report improved sleep and digestion within the first week, joint and energy improvements in weeks 2 to 3, and the deeper metabolic and cardiovascular effects building over 4 to 8 weeks. Now let me cover the 3 biggest mistakes most people make with olive oil. Mistake number 1. Cooking with extra virgin olive oil at high heat. This is the most common and most damaging mistake. Extra virgin olive oil has a smoke point of around 350 to 400 Fahrenheit. When you heat it above this temperature, the delicate polyphenols, including the oleocanthal and hydroxytyrosol we just discussed, are completely destroyed. The oil becomes nothing more than a generic fat with calories. If you want to cook with high heat, use avocado oil or refined olive oil for that. Save your real extra virgin olive oil for raw use only, drizzled on salads, finished on cooked vegetables after they are off the heat, and used in the bedtime protocol. Mistake number 2. Storing olive oil incorrectly. Light, heat, and oxygen all destroy the active compounds. Olive oil should be stored in a cool, dark cabinet, never next to the stove, never in a clear bottle on the counter where sunlight hits it. A bottle opened and sitting on the counter for 3 months has lost most of its medicinal value, regardless of how much money you spent on it. Mistake number 3. Believing that any olive oil labeled extra virgin actually is. The olive oil industry has a documented fraud problem. A 2010 University of California Davis study found that nearly 70% of imported olive oils labeled extra virgin failed the standards required for that designation. The safest approach is to buy single-estate olive oils with traceable origins, harvest dates within 12 months, and the distinct peppery cough test result. California, Australian, Greek, and certain Italian single-estate brands are most reliable. The cheapest store brand extra virgin in a clear bottle is almost certainly not what it claims to be. A few important safety caveats before we close. If you take blood thinners, warfarin, apixaban, rivaroxaban, daily aspirin, extra virgin olive oil has mild natural blood thinning effects through its impact on platelet aggregation. The interaction is usually not dangerous, but it is worth telling your prescribing physician you are starting a daily olive oil protocol. If you have gallstones or significant gallbladder disease, the bile flow stimulation we discussed can in rare cases trigger gallbladder pain. Check with your doctor before starting. If you take diabetes medications and your blood sugar starts improving on this protocol, your medication dose may need to be adjusted downward. Do not lower it on your own, but bring your improved numbers to your prescribing doctor. A second patient story that I think illustrates the broader pattern. A patient I'll call Constance, 78 years old, retired pediatric nurse from outside Charleston, came to me with 3 years of declining sleep, worsening morning stiffness, and a hemoglobin A1C that had crept from 5.8 to 6.3. Her primary care physician had suggested starting metformin for what was now technically prediabetes. We started Constance on the exact bedtime olive oil protocol I just described to you. 1 tablespoon of certified Greek high polyphenol oil at 10 p.m., 90 minutes before her usual 11:30 bedtime. We added nothing else and changed nothing else. 12 weeks later, her A1C was 5.7 DAR, back to normal range. Her morning joint stiffness was gone. She was sleeping through the night. Her primary care canceled the metformin discussion entirely. Constance now tells every senior friend she has about this protocol, and the most common response she gets is, "Why have I been pouring $15 grocery store olive oil on my salads for 20 years and never heard about any of this?" Let me bring this together. Extra virgin olive oil taken at the right time, in the right form, before bed, supports 5 systems in your body simultaneously through 4 specific bioactive compounds: Oleocanthal, Hydroxytyrosol, Oleuropein, and oleic acid. The systems are your heart, your brain, your inflammatory load, your blood sugar and metabolism, and your digestion. The protocol is 1 tablespoon of high polyphenol cold-pressed extra virgin olive oil, taken slowly 90 minutes to 2 hours before bed, on a near-empty stomach with no food chase. The 3 mistakes to avoid are cooking with it at high heat, storing it incorrectly, and trusting cheap grocery store extra virgin without the peppery cough test. Here is what I want you to do this week. Just one thing. Go to a specialty grocery store, a high-quality health food store, or order online and buy 1 bottle of certified single-estate extra virgin olive oil. Look for the harvest date within 12 months. Look for the dark glass bottle. When you get home, taste it raw on a spoon. If you feel that distinctive peppery cough at the back of your throat, you have the right oil. Start the bedtime protocol tonight. Give it 3 weeks. Notice your sleep, your morning stiffness, your energy, and your next morning glucose if you check it. Then come back and tell me in the comments what changed. If this video helped you, please do 2 things. First, share it on Facebook right now and tag 1 person you love who has been quietly stacking joint stiffness, sleep problems, or rising blood sugar without knowing what to do about any of it. You may be giving them the most useful conversation about a single grocery item they have had in 20 years. Second, please subscribe to this channel. I post a new video every week with the kind of honest, evidence-based health information I share with my own cardiac patients. A final note. Everything I shared today is general health education based on published medical research from the PREDIMED trial, Temple University, the European Food Safety Authority, and the University of California, Davis. It is not a substitute for personal medical advice. If you take blood thinners, diabetes medications, or have known gallbladder disease, please discuss this protocol with your prescribing physician before starting. Olive oil is not a replacement for prescription medications. It is a powerful complement used wisely. I am Dr. Marcus Okoro. Take care of those vessels. I will see you in the next video.